Chickenpox is a highly contagious disease caused by the varicella-zoster virus, primarily affecting children and characterized by an itchy, blister-like rash. The symptoms of chickenpox often start with a general feeling of being unwell, fever, and then progress to an itchy rash, with the appearance of red spots that swiftly develop into fluid-filled blisters over the face, trunk, and extremities. These blisters eventually scab over and may take several weeks to heal fully, with the entire illness typically lasting around 5 to 10 days. While chickenpox can often be managed at home with rest and over-the-counter treatments to alleviate symptoms like fever and itchiness, vaccination is a highly effective method for prevention, and antiviral drugs may be prescribed for severe cases or those with a higher risk of complications. Individuals who have not been vaccinated, those with weakened immune systems, and pregnant women are more susceptible to severe symptoms and complications from chickenpox. Here's a detailed look at the various aspects of the disease, shedding light on prevention strategies, long-term outlook, and how it interacts with the body's immune system. Symptoms and progression of chickenpox. Chickenpox, primarily known for its itchy, blister-like rash, starts with fever, fatigue, and a mild headache before the telltale spots appear. The rash progresses from red bumps to fluid-filled blisters, vesicles, that eventually crust over and scab. It typically develops on the face, scalp, chest, and back before spreading to the rest of the body. Intense itching accompanies the outbreak, and new waves of blisters can emerge in succession over several days. As it runs its course, usually within 5 to 10 days, the virus traverses through all stages concurrently, presenting a mosaic of lesions at different phases. Notably, after recovery, the varicella-zoster virus remains dormant but can reactivate as shingles later in life. Diagnosis of chickenpox. Chickenpox diagnosis primarily hinges on the telltale rash, itchy, fluid-filled blisters that eventually crust over, coupled with flu-like symptoms. Health professionals typically recognize it through visual examination, though in ambiguous cases, laboratory tests such as polymerase chain reaction, PCR, or direct fluorescent antibody staining can confirm the presence of the varicella-zoster virus. Accurate diagnosis is crucial not just for treatment, but also for public health reasons, as chickenpox is highly contagious. Early diagnosis can lead to timely isolation measures to prevent outbreaks, particularly important in vulnerable populations, and avert complications through antiviral medications for those at higher risk. Cause and risk factor of chickenpox. Chickenpox, caused by the varicella-zoster virus, is a highly contagious disease that spreads through airborne particles, direct contact with lesions, or respiratory secretions. While it's most prevalent in children, adults who haven't developed immunity are also at risk. Exposure to infected individuals significantly increases the chance of transmission. Certain factors amplify one's susceptibility. Lacking a history of the disease or vaccination increases vulnerability, as does having an immune system compromised by medications or other illnesses. Moreover, pregnant women who contract chickenpox can suffer more severe symptoms and pose a risk to the unborn child, highlighting the importance of vaccination as a preventative measure. Treatment and management of chickenpox. The treatment and management of chickenpox, primarily caused by the varicella-zoster virus, focus on alleviating symptoms and reducing the risk of complications. Since chickenpox is usually mild in children, management involves home care with rest, hydration, and use of fever reducers like acetaminophen, avoiding aspirin due to Reye's syndrome risk. Antihistamines can help alleviate itching, and calamine lotion can provide topical relief. For those at high risk or severe cases, antiviral medications like acyclovir may be prescribed. Keeping nails short and using cool baths can prevent skin infections from scratching. A vital preventive measure is the varicella vaccine, which has significantly decreased the incidence and severity of chickenpox.